Good afternoon, everyone. Good afternoon. Welcome, welcome. I am Ernest Coverson, and I serve as the Director of Gun Violence Prevention with Amnesty International USA. I would like to welcome and thank everybody for joining us this afternoon as we get ready to have some further great conversation around this human rights crisis that's known as gun violence. Um, excuse me. We're now going to discuss during this panel. We're going to discuss one of the solutions for this gun violence human rights crisis that's taking place across the country. Some of you may have heard of it, some may have not. And then we're going to talk about how it most definitely is happening right here in Detroit, about these community organizations known as Community Violence Intervention, or CVI. Right. The conversation's purpose today is to dive into the practice of CVI, and the organizations that's doing this life-saving work, the different types of CVI models, the funding of these CVI programs, and also to learn more about the program's workings that's working here in Michigan. So with that, we want to start the conversation. CVI, or Community Violence Intervention Programs. Some of you may have heard of it. Some of you may have seen the acronym CVI, but don't know what it is, right? Don't know what it means, don't understand why it's even out there. And so we want to go to our first panelist, Brother Juan Carter, and you can introduce yourself, but then also let us know what is CVI?
Thank you, Ernest, and good afternoon to everyone, or good morning to some folks on the West Coast. My name is Juan Carter. I am the outreach manager at the Giffords Center for Violence Intervention. Been in the CVI field for 15 years now. Prior to me joining Giffords, I was the director of street outreach at the Nonviolence Institute in Providence, Rhode Island. So it's definitely a pleasure to be here. But to your question, Ernest, we, at the organization at Giffords, we've always talked about CVI and street outreach, or whatever people want to give a name to. But we've always had homegrown folks in the community working on some level to disrupt violence. People who've always been agents of peace, but also close to those involved in gang and street crews, or individuals involved in street level violence. So we got together with some partners, and we didn't want to define it ourselves, right? We wanted to just kind of see a collective unit of people and folks that have been in the field for a long time. And so we was able to come up with a definition. And community violence intervention, also known as CVI, refers to a set of non-punitive community-led strategies that are designed to interrupt the transmission of violence by engaging those at the highest risk through the provision of individually tailored support services.
Cool. And with that, in cities and communities across the country, there could be various models of CVI, what it's looking like. Can you share what some of those are?
Yeah, absolutely. So, right, we started out with street outreach and violence interruption, right, with those men and women on the front lines working closely with those that are at the highest risk, right, those that are likely to shoot, get shot, or go to jail. And so we've always had that, but we saw, right, rather quickly that strategy or that approach alone we're not gonna see an overall reduction of violence, right? We need other supports and other entities to do the necessary work. And so we've seen come up, and it's been around, but I think it's been more common now that we have hospital-based intervention programs, right? People from the community in the hospital at the bedside, providing services to those victims of violence. And it's very crucial to have that piece, because usually at that time, right, even a young man or woman, if they're laying in that hospital bed, even though injured, they're thinking retaliation, right? Or their friends are thinking retaliation. So if you have somebody, not just a social worker that's in the hospital, but somebody that either is familiar with the community or has relationships with those that are involved in the gangs and street crews at your bedside, right? To not only talk you out of retaliation, but also providing some services into somebody that you can trust, but also they can, now go to the streets and be able to talk with the frontline workers on the streets or the street outreach workers to figure out a way, how do we either quote unquote ceasefire, right? Or prevent further retaliation. But also we want to make sure that the victims are not being re-injured, right? Not going back out into the community and being put in harm's way. So that's definitely another vital strategy and approach. Then, we have case management and transformational mentoring programs, right? So if we're working with these young people, we're building these relationships, but we're also getting them to a space where they're thinking about transformation, then we need somebody there to be there to walk alongside of them in that journey as well, to say, hey, what is it that you need? So that way you don't go back to the streets, right? Do you need housing? Do you need a job? Whatever it may be, those little things that some people might see as little things are major things, and major things that the young people that we're working with may need. And then we have what is known as group violence intervention, GVI. And more so or labeled as focused deterrence, right? Which has some law enforcement involved in that, but it also has some outreach strategies and has some of these things that are also involved as well. But we also, for those that haven't or are not very familiar with CVI and the work, we have to keep in mind that none of these approaches or strategies will reduce violence on its own, right? They all need to be working together at some point. Within their own strategies.
Yeah, most definitely. Just one last follow-up. The last piece you said in regards to it's not, the CVI is not the final or the piece that's going to, fix everything. Do you see many of these programs working together within communities across the country?
I think you see it in pockets, right? I think the one thing we can't leave out of the conversation is funding.
Yeah.
And organizations, depending on the size of the city or the state, people are going after the same funding sources, right? And so that's what's keeping kind of like a competition and people from working together. But I think if there's opportunities to put some funding together to create collaboration, because we know organizations are capacity-wise can't do what they need to do, but if we can get funding and organizations going together on funding opportunities, that's where I've seen the cross collaboration. That's where I've seen organizations working together.
Yeah, most definitely. And the funding we most definitely gonna get to, because that's a challenge across the board with the whole funding process and with that. And it kind of tie into, thanks Juan for that, kind of tie into our sister Jennifer that's joining us from the Michigan Department of Health and Human Services. Jennifer, the state of Michigan has started supporting these programs. And can you share what is happening in Michigan and how the state is supporting?
Sure. Thank you, Ernest, for the question, and good afternoon, everyone. We're so happy that you're here in this particular panel. I'm with my great colleagues here this is what we do, this is what we live and breathe, and so to be able to have space in this summit for this topic is really huge and exciting. So speaking of exciting, so the state of Michigan has made some investments in the CVI space, historic investments. And so very excited to be able to talk about that with you all here today. So in terms of sort of who I am and my role, I'll just back up a minute because I just start launching and talking. But again, I'm from Michigan Department of Health and Human Services. I oversee the injury and violence prevention programs here at the State Health Department. I've also been tasked to help our administration set up the Office of CVI Services. So there was funding that was put aside to help set up the office, as well as some grant making dollars. And that started sort of last March is when it first was announced, but really it's this sort of state fiscal year that we've been able to sort of really move some of those pieces. So last year, we put together a listening session with some folks that we know that are doing this work, but not everybody. And then we started just talking to some folks, really learning what's going on, who's doing this. as Juan indicated, there's different models out there. So, even here in Michigan, there's the GVI model, there's the street outreach and violent interrupters, there's the transformation mentorship, there's programs that really, the hospital-based intervention program, wraparound services, victim services. We have a lot of the different models here in Michigan. So pretty excited about that. There is no one model. There's no one size fits all. I think it depends on the community, and certainly Quincy can talk later about how, some folks, do work together, have different niches, but, there's a lot of times that people do come together to do this work. Folks have been doing this work well before we use the word CVI, right? This has been decades of peacemaking that people are just doing it because they were tired of the violence. They wanted safer communities. They didn't have the infrastructure or program or called it CVI. It was just, this is what needs to be done to keep my family, my friends, my community safe. So in terms of the state, we have this office within the State Health Department. We do take a public health approach to violence prevention. So that's looking at collecting data, understanding the scope of the program, the problem, who's being impacted, where are we seeing those impacts, and then using some of that to make really targeted sort of data decision-making interventions. Where should our limited dollars go to really help address community safety? We know that community violence is everywhere in every single community in Michigan, but we also know, looking at data, that maybe there's some areas that might need some additional resources and support. So part of what we do in a public health approach is we collect the data and we address those known risk factors. So we know there's risk factors for when we look at violence, okay? So that's, interplay of stressors, which is exposure to violence, threat of violence, obviously exposure, witnessing violence. It's the systemic racism. It's the economic instability, not having jobs. It's the limited housing and education. All these factors sort of have an interplay, and just seeing communities that have been historically disinvested and under-resourced. And so really looking at all of those kinds of risk factors, as well as looking at some protective factors in terms of community connectedness and support and access to services, and doing just like what Juan said, which is, looking at some individually tailored services to help some folks make some different choices or make some healthier choices. And really, what does that look like, and what supports are needed for that? And then finally, when we think about some of this public health approach, it's, looking at these different models, the promising practices, what works in a community, some, evidence-based, it's implementing them, it's getting feedback from folks how these are working. So, Quincy can certainly talk about Detroit. We've seen a lot of this sort of work being done in Detroit. And I'm not going to name check any names because I don't want to get into trouble, but there's so many good folks doing this in Detroit. And so I'm not from Detroit, and I will say there's lots of good things going on, and I can let Quincy talk about Detroit. I do want to shout out, there's other pockets in the state who are also doing some great work that have maybe not have had the infrastructure of a program, been doing it with individuals, or have just been really starting to engage in this work, either on an organization level or lots of individuals. So, shout out to Kalamazoo and Grand Rapids and Lansing and Ypsilanti and Flint and Saginaw, Muskegon, they've all stepped up and have been doing some work in these spaces. So we really see sort of our role at the state. One is we want to start cataloging, in terms of a list to share with the other folks. So the purpose is to share the CVI sort of group and list and individuals doing this work with other folks doing this work, so people can start to connect more and share and talk about what's working, what's not working, best practices. And so that's something that we see as a good role for the state to help do, is to help facilitate those kinds of discussions, because this work is quite siloed. as it needs to be. You know, you have to really know your neighborhood and your community to do this work. However, we do think there's some strength in being able to connect and share with each other, you know, to be able to talk about what they see in these models and what partners are at the table, and even sharing, you know, some funding opportunities. So I said that word though, funding. So I'm going to segue over to that. As I mentioned, the governor did create, with the support of the legislature, the CVI office. And so we had some, again, through the legislature, some funding to support the office, as well as some grant making. And so we were able to, just like a lot of states and cities across the country, utilize the American Rescue Plan Act, or ARPA dollars. There was specific designation for CVI within those ARPA dollars. So states and communities could designate their ARPA dollars for CVI. And so that's where a lot of, I think, more recent, in the last couple of years, support for CVI programs and funding came from, is from the ARPA dollars. And so that's certainly true here in Michigan. Both the city of Detroit allocated $10 million for CVI using their ARPA dollars, as well as the city of Kalamazoo put $1 million of their ARPA dollars for CVI. There could be other cities in the state that have done that too. My apologies if I was not tracking on that in other cities. Those ones I know put out some big investments, including a request for proposal of using their ARPA dollars for CVI. So not trying to leave anyone else out. We need all hands on deck for this crisis. So in terms of the state, we did put out a request for proposal 2 in the fall for CVI funding. And so we were able to, right before the holidays, announce and fund 8 organizations, a little over $7 million for the scale and reach of CVI programs. So again, quite a historic investment here at the statewide level. Very excited to be able to be part of this. But clearly, you know, we're working with folks, those grantees, as well as folks like Quincy and other folks in Detroit, to really help provide additional support and scale this important work. So I think that's what I wanted to say for now, knowing that we can get into a little bit more later.
Oh, cool. Thank you. Thank you. That's great information. And thanks for the work that you're doing. I know it's, as I've been working across the country in my capacity with cities and states that is doing the same type of thing and getting this started, right? There was no blueprint to how to do this CVI work. And then just to fight to get CVI recognized. As you were saying, it was organizations that's been doing it in a quote unquote mom and pop type of situation that didn't get the respect of the work that they were doing. And so being able to show and prove has been a challenge. And I wanted to tap on that, like the data, as you were saying, you know, everything we do now is data driven, right? And so organizations that are small, that are doing impactful work, has had the challenge of not having that data to present to, say, your office, to say, hey, this is why we deserve X amount of dollars. Any thought on how do we assist those organizations, get them up to speed, maybe connecting them with larger organizations, et cetera?
A good question. So, you know, in terms of some data, that's where we can also provide some support and technical assistance, right? So I do think that within public health, it's one of our roles that we play is that data collection piece, that we can help with local communities and sort of think about what kinds of data to collect that also would be impactful. There's other community partners that have some really rich data locally too. And so I want to state that, you know, there's some data that we have, but it's not to negate the richness of community level data that's actually being collected by community partners. And so I definitely want to give that shout out to, whether that's community organizations doing this work, local law enforcement that has some of the data around maybe like homicide numbers and shootings, and Also, there's some really power in when we talk about data. I think we think larger data. We also think storytelling, right? Because I can give you stats all day long, but it's the stories that will
Right,
stay
right.
with you. It's the stories that will be impactful. And that stories of the picture of what's going on in the communities, as well as stories of really walking along journeys with somebody who's gone through some of these situations, and we think about how we are able to mitigate escalations of violence. Quincy does life-saving heroic work. Quincy runs in when some of us run out, he runs
Right.
in. So I think about those kinds of stories and sort of that transformational mentorship stories. And I also think there's a role to play for local foundations in terms of their support financially, but also their opportunities to help with that data and that storytelling as well.
Yeah. Oh yeah. We need to gotta put you on the speaking tour, Jennifer. You got some good information to
Well,
tell the people.
there's certain things that I know, but I'm not an expert like Juan and Quincy here. So just really humbled to be part of this conversation today.
No, thank you. And everybody has their part to play. Last question though with you. In regards to the office, is it a permanent office? Is it just for this administration? What do we have in looking forward with the office?
It is an office. It is on our org chart for our state health department. This is a dedicated office. And so,
Cool.
we realize in public health that, if we want healthier communities, we have to address violence, and we have to address the risk factors for violence, including those social determinants of health. So this is an office within our state health department. So hopefully
Fabulous,
that answers your
fabulous.
question.
Yeah, thank you, fabulous, fabulous. And as you were saying, there's many factors when it comes to community-based violence or violence in, specifically Black and Brown communities, especially. We see over the airways, above the folded news when the mass shootings take place, which are horrific, and we understand that. But with community-based violence that takes place, there's many factors, as you were stating, from the systemic racism in the communities, the lack of funding, the lack of access to good water, to good food, employment, etc. So as we deal with one piece of it, we also have to deal with all the other pieces. And so, many times in the gun violence movement, folks are saying, that's just the gun violence folks. They deal with that. And the water warriors don't talk to the gun violence folks, or the food justice folks don't talk to the gun violence folks. So somehow in these communities that's dealing with all of these pieces, we have to come together and talk about that and have those conversations, because we have to deal with all of those layers. And I know Brother Quincy, we're going to talk to in a second, deals with that in all of those pieces in those communities as well. And so as we're talking about funding, though, there's research saying that there's it costs like $170 billion. Gun violence in the country costs $170 billion a year. That's from, police and medical and everything else, for $170 billion that the country is willing and communities are willing to pay that money, but do not want to fund these CVI programs that could really reduce that effects of violence. And not only, from the shooting, but then you got to look at after that, the afterlife of that moment and the services individuals may need to survive once they are survivors of a gun violence moment and that type of thing. Those ARPA funds are there. And then, also we and other, I know Giffords and other gun violence organizations across the country has been working to get a piece of legislation passed federally called Break the Cycle of Violence Act that would provide $5 billion over 8 years directly to community-based organizations that are doing this great work. And so, we can't get it passed. We've been fighting for a few years, and that's a whole nother conversation. But there are efforts out there that we continue to do to get this funding. So state of Michigan, city of Detroit, Kalamazoo, the weight is just not on those local municipalities, but the federal government also do something to address this gun violence situation as well. So thank you, Jennifer, in that. And as we said, at Amnesty, we had a campaign last year, past 2 years, that we titled Heroes. And this campaign talked about or elevated and highlighted individuals in community-based organization doing great work on the ground, where we elevated their story and got them the recognition or pushed to get them the recognition that they were doing. Because even during COVID, and I know Quincy know and Juan know, even during COVID, they were still out doing the work. They was, some getting paid, not getting paid, had to become not only gun violence professionals, but also what is PPE? What is this? Where do we get the vaccine? So they had to know all of that stuff during that time. And so these heroes that we listed and highlighted as well, and I would put Quincy right into the middle of that as well as a hero there in Detroit from Detroit Ceasefire. So Quincy, introduce yourself, bro, and tell us about your program.
Absolutely. First of all, it's an honor and a pleasure to be here and to just dialogue and have real conversation with folks who are impacting this work on such a high level. So I'm extremely honored just to be a part of this conversation. So I'm long life Detroiter, born and raised on the East Side. I'm son of a preacher. I grew up in the height of the dope era on the East Side, man. But I am eternally grateful because I had a father, man, who was a disciplinarian, and he ruled his house with an iron fist. And, he balanced that with love. But there were certain places I could not go. All my friends could go. But I couldn't go. And it very frustrating as a 15, 16-year-old kid, right? But now I sit back and, it's impacted how I raise my sons, right? How I raise my daughters, right? So I'm grateful. We would hear the shootouts, we would, see the dope deals, the gang wars, YBI right in the same community, the Chamber Brothers right there in the same community. But I'm grateful, of my upbringing and the example that I had in front of me. It reminds me of this was 1996. My father did, and he was real big on ministry outside of the four walls of the church, right? He did a gang summit in 1996 where he brought in one of the leaders of the Crips gang, Batman, right? Started the gang with Raymond Washington and Tookie and all those guys. And he came to the church. We hit a few schools that day, encouraging the kids to come on out. And we get to the church that evening. We opened up the service, and Batman was supposed to come up and, and do his thing. Pops got up there ready to introduce him, and Batman wasn't in the room. We were all looking around like, well, where's he at? I look outside the window of the church, and I could see him on the corner with about 30 gang members talking to him. Those 30 guys did not come into the church, right? It's difficult, to get guys to come into those four walls. But what do? You take that message to where they are.
Yes,
and that had a profound impact on me that day. And I think every job I've ever had was serving my community and reaching out to that next generation, and giving them the knowledge and the skills and the tools, right? That they need. And that right there, I think set a course for my life. I didn't know anything about Ceasefire. There was a good friend of mine. I was in the youth work. Worked in schools. I was a dean in administration in the urban education setting, but didn't know anything about Ceasefire or gang violence intervention work. I was new to it. This is back in 2015. A good friend of mine by the name of Ray Winans, brought me on and says, Q, I think you'd be a great fit for this work. He was the outreach coordinator at the time for Ceasefire, and brought me on. And I said, man, what are you getting me into? But the beauty in it is a lot of those guys, I had known, from working schools, knew the families, and coached some of those guys, in basketball. So the relationships were there. And it started to make sense to me where, I would tell myself, Quincy, you have a voice. Quincy, these guys are listening to you. You can set a course, right, and change the direction of a lot of these individuals, man, because that relationship is there. And I started to understand we're in the relationship building business. That's what this is about, right? Yes, we understand what is plaguing our community. We understand, looking at this thing from a public health issue and addressing it from looking at the social determinants of health, right? And doing everything that we can to provide the resources, right, for those impacted by violence, right? But if I'm asking that young man to take that gun out of his hand, I got to be able to replace it with something, right? I got to be able to replace it with something, and so it's using those individuals who at one point were responsible for the violence in our community, right? Spending time with them, getting them prepared, educating them, nurturing them, right? Understanding their trauma, right? And getting them in a position and giving them a platform, right, where they can reach back to that younger generation. Because we're seeing right now 11 and 12 and 13-year-olds, right? It's generational. Some of the things that we're seeing. We had an 11-year-old killed 2 weeks ago. And it's not confirmed yet, but from what the streets are saying, it was another individual, another young man close to the same age as him, right? And this is street beef, throwing up gang signs, using social media, right? To antagonize and carry on this mindset, right? And this behavior, but they got it from somewhere.
Yeah.
They didn't learn that, just because they picked that behavior up. Somebody's demonstrating that behavior, right? And some of them don't even understand the historical context of the gang landscape in the city of Detroit. So now you bring in guys who are responsible for creating that mindset, creating that gang landscape, and say, you know something, you have to bear the weight of public safety, right? Law enforcement can't do it by themselves. Faith-based can't do it by themselves. Street outreach can't do it by themselves, right? This is your story. Take the lead, take charge. And what we're seeing right now in the city of Detroit, and I believe that this is really as a direct result of the mayor, his office, making sure that they make a substantial investment into community violence intervention groups, right, who have been doing the work, right, without the resources, right? And this is the time where we got to get egos completely out of the way. Ceasefire has been here, right? That was the first GVI, focus deterrence model here in Detroit. We've been here doing the work, right? But recognizing there are other groups who have a niche, right? They're respected in certain communities in this area, right? How do we do cross-neighborhood resourcing, right, to work together, right, to provide resources to these families and individuals? We got to get the ego out of the way. This is not about us versus them. This is about everyone working together and the collaborative approach. And I think that's what we've seen here in Detroit, making the difference, right? We're seeing things that we've never seen before. Crime is down. We're not celebrating or, doing any victory laps, but, I think we are absolutely headed in the right direction. And that's because of that collaboration and really us looking at violence, as an infectious disease, you know what I mean? That we got to find a cure for, and it's us working together to provide that cure for sure.
Yeah, no, most definitely. And from, like you say, born and raised, knowing that whole landscape you laid out, man, it's so interesting to see, and it was there before us, but I mean, to see some of that birth of the new wave and then where it is now, like you say, to have 11-year-olds in the midst of it and carrying out stuff that, cats our age, were, starting this whole phenomenon kind of thing, in our city as well. Most definitely. How have you seen the work, and that might be it there, but how have you seen the work change over the years since you've been there?
Yeah, I think there was and I think somebody already alluded to it. There was a shift once COVID hit. Ceasefire is a focus deterrence model. We use the David Kennedy model, but it's the Detroit brand, right? Something we pull from it, something it doesn't fit Detroit, but essentially we give credit to where it's due. So we do use the David Kennedy ceasefire model. But there was a shift during COVID, where you saw that transition from group violence intervention to community violence intervention, right? And Juan laid it out, really clear on what that looks like, a great definition. But it is, bringing credible and respected messengers, right?
Yeah.
The table and giving them the platform, making sure they have a voice. Because, as, embedded on the East Side as I was and all the folks that I knew, me telling the kid to put the gun down instead of, somebody else who was a 7 Mile Blood or was a 4-2 gang member, them
Right.
telling there's a huge difference, right?
Yeah.
So us, as OGs, us giving those younger guys a platform, right, to echo their voice, to make sure they have the resources that they need to carry this work on, because we're not going to be here forever, you know what I mean? So making sure that we're leaving a deposit, right, to those who can take this work to another level. And so it's really making sure they also understand that it's going to take all of us.
Right.
And that's, I want to make sure that's not a cliche. Like, it's going to take all of us. So we've got to be real intentional about everyone sitting at the table and having those real conversations. Ceasefire isn't good when there's a lot of our gas stations are owned, Middle Eastern background, right?
Yeah.
So if there's an injustice done by someone who, visits that gas station or liquor store, right? There's an issue there, right?
Yeah.
Ceasefire isn't great at going in and having that conversation with the store owner to say, hey, we got to look at some policies and how we deal with the, deal with the community, right?
Right.
There's another group who's great at that, right? So let's build that relationship with that group. I don't have an outreach worker or a credible messenger for every community in the city of Detroit, but I know somebody who has credibility in certain communities, right? Last summer, perfect example, there was a homicide a little north of Midtown. And I didn't have a team member who had credibility in that area. So what I did was I reached out to somebody who I knew who had that influence, right? I'm not going to go into a neighborhood where I know I don't have, I don't have that influence like I should. So I reach out to who does. Right. We bring them to the team. We go in and we're able to diffuse. We're able to provide resources, right, and talk to families and talk to individuals who were impacted, right, by that community trauma. So that's another way where we can make sure that we've got the right people at the table. We're building those relationships, respecting other people's lanes, right, and giving that message that we're all in this thing together.
Yeah, no, most definitely. So it sounds like you do work, and I think I posed a question earlier, but work with other organizations.
100%. Matter of fact, just this morning, as a result of that 11-year-old getting shot on the East Side, getting killed on the East Side, I'm partnering with the CVI group, Detroit Friends and Family, where we're going into the schools with rival gangs. So these are heads of rival gangs going into the schools together to present a message of peace. When those kids see these gang leaders, right, on the stage together, saying, you know what, we were wrong. We were wrong. This is the direction that we need to go in now. And they see those guys shaking hands on stage. That's going to be powerful. That's our first session is tomorrow morning, but we're doing that with another CVI group.
Gotcha. Oh, that's hot. And actually, I was leading to another question I had, but you already answered. Like, is there school programs that you're working with and doing as well? And then real quickly, I'm gonna switch lanes as well. But for credible messengers, give me a definition for the folks on what a credible messenger is.
Sure. Those with the street influence that can go in and have a voice that can deter violence, right? Those who are, at risk of violence and maybe gang involved, closest to the problem, right? But these credible messengers and individuals can go in because they have community influence, they have street influence, right? And can convince those individuals to put the gun down and resolve their issue peacefully.
Yeah. No, most definitely. Thank you. And for the audience, most definitely want you to know that you can use the Q&A tab and ask questions, and I will look through those and read those and get those questions answered as we go through as well. So we do want to have this as interactive and get you your information that you want before you leave the session as well. So Juan, I want to come back to you. Where do you see, as you have a national scope, where do you see the CVI movement going? Is it here to stay? Is it credible? Are we making an influence? What you thinking?
No, I think coming from the front lines, I'm always going to represent the outreach workers first. No, I believe it's here to stay. And I think it's very impactful as we see it happen in pockets, and there's, significant reductions in violence in certain cities and towns.
Mm-hmm.
Like you said, we always know one shooting, one homicide is one too many, right? But we want to attain to that significant reduction and keep those reductions. And we want safer communities, right? Overall,
Right.
we want safer communities. I think we, have to talk about what happens when those significant reductions come. And what is the space for CVI then? Right?
Yeah.
Does the organizations just shut down? Right? Because that's the goal. We want to see low levels of violence. And then what happens when, Rhode Island's deemed a safe state,
Yeah.
right? So there's not this over influx of funding coming through the state because it's deemed a safe state. But there's still a role for CVI workers, right? Because we still
Right.
need messengers, right? We still need people of influence because there are other issues that we know that the participants that were involved in gun violence, they need other things. They need resources. I think how we, move this forward is the professional development of our outreach workers, right? Our front workers, and what does that look like for them? Because we're talking about success, and we know, and Q just kind of alluded to some of that, is that most of, if not all, of our outreach workers or the frontline workers that work for these organizations are clients as well,
Yeah.
because they come from the same neighborhoods.
Right.
They
Right.
also have that trauma, they have that experience, those lived experiences that the people we're working with have. And so how do we elevate them, right? We don't want our outreach, our frontline workers leaving the organization and going back to the streets, because that is what could happen, right? If they're not, right? So how do we invest in that as organizations to make sure that our frontline workers are getting evaluations, right? Yearly or, semi-annually evaluations, they're getting pay increases, right? But they're also getting other opportunities to grow professionally. Because I've seen it, I'm pretty sure Q has seen it. Kids will come up to you and say, hey, why you ain't teaching at this school? Right? Because they feel like we have more influence and we're more credible than the teachers that they may have. And
Gotcha.
so when you hear things like that, why can't a frontline worker become a teacher? Why can't a frontline worker become a social worker in the hospital if they wanted to? Because they do have the experiences, right? They do have the experience of working with young people. But what we know about those particular professions, they're protected by education, right? And so how do we make sure that our frontline workers are getting those opportunities to grow? Because I think that ultimately determines, one, the success of the organization, not on the client side, but also on the employee side. But then ultimately, we know that most of the men and women doing this work live in their communities. Right. They're not getting paid well, so they feel like they're stuck in their communities because the rent might be, they're getting assisted living or what it may be. But if we're talking about overall transformation of our community, it would be great that if they decide to move on from the organization, or if they're still in the organization and they're making good money, to now invest back in their community, potentially buy a home, right? And things like that. That's the transformation that we need to see. And I think if we, outside of doing the work, we know we need to continue to do the work, but if we're investing in our frontline workers, I think now we're prolonging the career. Right now we're saying CVI is good, right? Because they're good and they're doing the work and they're professionally developed.
Oh no, that's hot. That's hot, man. Most definitely need to do that. I got a question from our audience. I guess it could be for anybody, but it says, how can I better create and bring in more people to build an organization to help our youth in the area? There's just a little background. There's a lot of gatekeeping information in the community, and it's hard to create different youth adult mentorships to keep the youth together. And so how do they better create or bring in more people to build an organization to help the youth in their area? That could be for anybody.
I guess I can take that one. Identifying who the gatekeepers are, who has credibility and who has a track record of doing this work, right? Or community influence, right? And it takes time to build those kind of relationships. Again, we're just getting to the point, 2020, 2021, where we're seeing that kind of collaboration, but it takes time to get there. But I think starting off on the ground, having those platforms and those those sessions where you're bringing key people to the table, right? Those stakeholders, right? People who are invested in the community, want to see change, right? And really just start there and really just building those relationships, and that's kind of how you build that foundation or create that foundation for the next level.
Most definitely. Most definitely. Anyone else on that one?
And I think Q answered it perfectly. The only other thing I would say is, besides getting to know sort of the community, who are the folks you should be connected to, but also looking at, are there gaps? Where are the gaps? Because I think before are there ways to partner and create a new service? Like, I think doing all those kinds of things first and really talking to what programs are out there, what do the youth need, make kind of doing some of that groundwork first and seeing where gaps are and why are there gaps. All of those things, besides what you said, I think are really good before you kind of launch into this, is really having a good understanding of the services now and what is lacking.
Yeah. And that kind of tie in what I wanted to ask you too, Jennifer, like the expansion, is, DHS looking to expand its reach? You said you did 8 organizations in this first iteration. Is there some expansion looking and or how can people, help in that expansion?
That's a good question. So, the way that we wrote our RFP, it's for funding that's through this year and next state fiscal year, because we also receive some state dollars to do this
Gotcha.
important work. So, when you talk about expansion, like, I am there. Yes, that's what we wanted. We wanted that yesterday, but I also have to look at sort of what we have and really take stock that, we didn't have any of this last year at this time. So
Yeah.
it's really like, okay, I'm thinking expansion, but we're really kind of starting with some of these investments and getting these dollars out the doors to communities. So really we are funding like other folks and other organizations. We kind of think about it from like state fiscal year to state fiscal year and
Yeah.
building those plans for sustainability. But right now, that's kind of where we're at. So we're anxious to get started and working with folks, but with an eye to expansion. I think some of the programs we're investing in is an expansion. And so that's kind of where we're at right now. But absolutely, I think that I would love to see continued investment and expansion in, sort of looking at all the different levels and levers that we have. So federal government and, state, I think local, in terms of really helping support. When I say that, I mean supporting communities to do this work.
Yeah, most definitely. And real quick question on that and the funding part. Did were counties involved in some of the funding processes, or was it just like state, federal dollars?
So I believe, and I think I saw something in the chat about that with Kalamazoo, but typically it's been a little bit more, not as much counties
Gotcha.
in terms of our state dollars. So our dollars came to the department, through ARPA, as well as some state dollars. And so certainly counties could apply for the RFP that was put out in the fall by MDHHS. And there are counties that are really invested in this space. So I would say that I've seen that even in Michigan, where I've had counties contact me and say, we know we're in the space, we want to do more in this space.
Yeah.
Maybe we should be thinking about citywide and county offices for CVI. So definitely, I think that there's been some interest there.
Oh, cool. Most definitely. Because I know in the ARPA funding, we, myself and other orgs and some folks were pushing, right, both state, counties, and cities to, as you was stated earlier, designated dollars, to CVI work and was pushing folks to do that. So just wanted to see if some of the counties was doing that. And for organizations that are out there on listening, there is dollars through your county as well that you could possibly petition for as well to do the work you're doing. I want to switch real quick in regards to some of the work, and this and maybe Q or some others, but the survival work. Are there organizations, or even your organization or others, Juan, you may know, on the survival side of it? We, at Amnesty, we did a report a few years ago titled "Scars of Survival," and it talked about the challenges that individuals and families have once that moment of the shooting is over. They don't pass away, thankfully, and so, but they have to now live life after that, and from the hospital intervention pieces that Juan talked about, but even past that, like getting in contact with the state funding that's there for victim violence as well. So are there organizations that's doing survival work in communities and assisting families in that type of after the fact?
Yes, sir. So that's such a huge part of the work. And the first part of that, it's being there when the violence happens, right? It's being there to wrap your arms around, right, these individuals and these families to provide support.
Right.
We're meeting them at probably the worst day in their lives, right? And so that aftercare piece is extremely important. We rely heavily on our faith-based community to provide that work. There's an organization that's an arm of Ceasefire Detroit called the Faith-Based Coalition of Detroit. Okay, that's led by Bishop Darrell Harris. Bishop Harris has put together a coalition of over 50 churches, both inner city, suburban churches, working together to provide resources and support for victims of violence. Okay. There is another initiative or strategy, I should say, from the David Kennedy model, that was developed by Paul Smith, called CPRVV, Community Police Response to Victims of Violence. So that's, law enforcement, that's your chaplain corps, that's ceasefire, faith-based, working together. If a family needs to be relocated, right? That family cannot go back in that house. How do we support that family, get them to a safe space? So all groups working together to provide safety and relocation for that family, right? Some of that stuff is low-hanging fruit. It could be simple things like, feeding the family just for that evening or whatever the case may be. We're just there to help pick up the pieces, and provide them all the support that they need.
Oh, cool. Yeah. And I think, many times that's a piece that does get overlooked, is that survival side of it. And, after that moment, it happens, okay, cool. But now how do we make those families and those individuals that, back whole again in the situation as well?
If I could add.
Oh, yeah, please.
To what Q was saying, right? We, here in Rhode Island or in Providence specifically, we had an example of, right, like some of the injustices, even right after. In this example, the unfortunate, the two young men are no longer with us. But we're talking about that aftercare, right? Victims compensation, right? And in certain states, how complicated that process is. And so, for example, two feuding sides of towns. Unfortunately, we lost two young men. One of the stipulations to victims compensation is that if you have, I know here in Rhode Island, if you have a violent felony within the last 5 years, you can be denied. And so one of the young men, unfortunately, had a violent felony and didn't get victims compensation.
Yeah.
The other young man didn't have any charges, was approved. Now, family on the other side, rightfully so, and not knowledgeable of the process, right? And so felt like they were slighted. Well, why did he get it and my son didn't get it, right? And they're two rivals. And it put a lot of pressure on the organization, but it also can cause more violence because the family is frustrated now. They already lost their loved one. Now I can't get services, but my son's enemy got the services, right? And so what that does. And so we did some work here when I was at the Nonviolence Institute, not myself personally, but some of my coworkers, to try to change, right? And so we're talking about advocacy now for on the behalf of victims and survivors. It's the victim compensation is one of the places, right?
Right.
And there's so many, like in Rhode Island, the application is back and front. It's one sheet of paper. I've seen other states where it's a booklet,
Yeah.
right? And what family would want to fill that out after, right? Like, I don't, that's too much, right?
Right.
We wanted to make it easy, basic information, front and back. Also, we did some work with law enforcement, with the local police department to try to establish what we call as a professional understanding, right?
Mhm.
But how can we also help you as law enforcement build some bridges in the community as well and build some goodwill and things like that? Is that you can't use victims' compensation as leverage,
Mm.
right? Saying that, oh, you know who shot you. If you tell me, I'll prove that for you, right?
Mhm.
And so we did a lot of work around that is because if they put on the application, victim was uncooperative, it's an automatic denial, right? And of course, in most cases, and I'm pretty sure Q experienced this, going by bedside, most of the young guys, whether we know them or not, don't want to talk to us.
Right.
So they're definitely not going to want to talk to a cop, right? And so we did some work in the hospital and with law enforcement to say, hey, come back.
Mhm.
And we'll even do you a favor in some cases, potentially go back with you, right? Because we have the relationship. And we
Mhm.
know that victims' compensation in this particular instance can be a service to you, could be a service to your family because what it offers. And then that, having that relocation piece, right? Like being able to relocate you if we need to, because you can't go back home. Ernest, if I survived the gunshot,
Right.
I have to go back to my house.
Right. Right.
Go back to my house becomes a target. And then
Mhm.
everybody that's in that house is a target now, right? And so we're talking about the after effects and the trauma that comes along with that. Like, yeah, the house may never get shot at, but imagine being a little brother or mother or father of that young man, walking out of your door, looking left and right, because potentially your house can get shot up because your son's here, right?
Right. Right.
So I think all of those things have to be taken into effect. But again, on the advocacy side, I know there's a lot of organizations doing that survival work, which is very, very important. But how do we take that to the next level? Advocating on a legislative level around victims' compensation. And I know there's some people doing a lot of work across the country around that to change some of these things. So that way this can be a better support to families.
Yeah, yeah, no, most definitely. Thank you for that. And it's true. The advocacy work, as we was talking earlier, I mean, it's different. Everybody got a part to play in it, right? In this thing we call gun violence and trying to end gun violence. And that advocacy part on the state level as well as federal level is as important part of it as well, because as you were stating, on those victim compensation funds, yeah, when like I said, we did our report and did some investigation. That's when I got educated on it. Was yeah, just the questions they asked, the time frame they wanted done in 30 days or 15 days after, and all of those type of things is just ridiculous. When a family or individual has went through this traumatic experience and now you want all of this information instantly as well. And so we do have to, and then a lot of people don't even know there is a victims compensation fund within their states. Some states we found out that the federal government gave so many dollars, the state matched those dollars. And if they don't, hand out that money, then the federal portion go back to the federal government at the end of the year. And so it becomes this cycle of additional madness around individuals and this whole gun violence situation as well. So yeah, so I think the advocacy part, those of us that do the advocacy side of it, in support of those on the ground, most definitely is important part of that as well. But I do want to hit on a question. I do have, it was a message from Sister Gwendolyn Hooker from the Kalamazoo area. She did say that she was part of the group that wrote the legislation to get the Kalamazoo dollars that Jennifer talked about earlier. But she also stated that, they do individualized wraparound services and support for the surviving children of gun violence. So there are programs that's out there as doing that work across the state as well. And so most definitely, you know, if folks are looking for that type of work, you don't have to recreate the wheel. It's folks out there doing it. And that's the piece I know that Quincy had talked about. You know, we got to talk to each other. We don't have to create it and try to figure it out. There are folks that's out there doing it already. So most definitely, thanks, Sister Gwendolyn, for that. Quincy, question. In regards, it was spoke about, I think both you and Juan has said about law enforcement in this situation as well, and working with them. How with CVI orgs, how is it working with law enforcement? And I know dealing with the community, you know, is you know, not looked it's looked shot upon to have, you know, having
Tell
those
the truth. Tell the
you
truth.
know, try to be right here.
Yes,
But
sir.
you know, but yeah, how is that, you know, how does that help or hinder the
Sure.
work of CVI orgs?
Well, I can tell you here in Detroit, it has not been an easy task. But I have been intentional about not building a relationship with the department. I've been intentional about building relationships with specific officers, right, who I know that care about Black and brown communities, because that's where they're from.
Yeah.
Right. They grew up in certain communities and they know how to police with the community lens. And so those are the officers that, you know, we are intentional about building relationship with. But as a department whole, you know, we're in a space where we can have those sometimes uncomfortable conversations and we can speak the truth, right? And, you know, things that we may see on the ground level, you know what I mean? And then we have relationships up top where we can say, you know what? You know, we may need to look at, you know, this situation a little bit differently because this is what we're seeing on our lens. This is how you can build that bridge between law enforcement and community, right? So for me, I feel like we're just in a great space to do that. I think it's an ongoing, you know, kind of road where CVI groups and law enforcement, you know, are, you know, working together. You know, when CVI Shot Stoppers, you know, when it first started here in Detroit, you know, kind of that was the question, you know, how are these shot stopper groups going to work with law enforcement? So we're intentional about even being that bridge because we've built those relationships with certain precincts and, you know these officers, know them by name, right? And so we have kind of acted as that go-between, right?
Gotcha.
It's not easy to get community trust and get law enforcement trust at the same time. That is tough. That is tough. And we haven't always been great at it, you know what I mean? But we have come an absolutely long way. And again, it's the face, it's the name. I know this individual, right? I'm not concerned about you trusting Ceasefire. I'm concerned about you trusting Quincy, right? I'm concerned about you trusting, you know, these guys on my team, right? And so being intentional about getting to know one another. Like we're intentional about that. We're intentional about being in that same space. You know, it's a completely different interaction when I know you. And it doesn't necessarily have to be about the work. Our kids went to the same school, right? We grew up in the same area. You know, we love the same sports teams or whatever the case may be, but finding that commonality, right, where we can build that relationship. And so, you know, that's how we've approached that and being that bridge. And then when we need to call out the BS, we call out the BS.
Yeah, most definitely.
And I,
Please.
And everything Quincy said is right. And so I learned just through my time and, you know, being around the national scene for a while and doing trainings with other organizations and guys that have been in this work, and the term, right, professional understanding. And I think depending on where you're at, where your community is at, as an organization, you got to be careful of certain terms because people take those and they interpret them the way they want to. So if an organization says we have a partnership with law enforcement, immediately, oh, so there's a transference of money somehow, right? Somebody's paying somebody or police are supporting the organization. And so professional understanding made more sense, right? We're both professionals on either side. We just need to understand each other's role, right? So I think we know frontline workers have a role. We know law enforcement is here to stay, right? They're going to be in the community. But I think it's just understanding each other's role and having that respect factor. I get it. You have your job. I have my job. And how do we continue to educate each other on what that work is? Of course, law enforcement is going to look, hey, you hired so-and-so. I arrested him a few times. I know his history. He's in and out of jail. I don't think he's going to change. That's just me. You put him back on the street. Okay, but I'm watching him, right?
Right.
Okay, watch him. Because there also needs to be some level of accountability for outreach workers too, right? Because we know there's good and bad in everything, right? And so there's got to be that level of accountability, but I think there's got to be that respect factor. Also, in the trainings that I've been a part of, just telling our frontline workers, don't make this an adversarial, right?
Mm-hmm.
Don't make it another beef that we need to take care of as frontline workers. We don't need any more issues, right? We're already dealing with street level violence. We don't need that issue as well because it's just going to complicate the work. It can be a disagreement. There can be, right? But it doesn't have to be adversarial. And then the other thing is, it goes back to that professional development. How do we take our frontline workers and address the trauma that they have? Because we know there's a lot of trauma with them in law enforcement, and that needs to be addressed. Because if it's not addressed, then it's always going to be adversary. I don't like you. You arrested me. You had a huge impact on my life in a negative way. But once we address that trauma, we now have to remove ego because now this work is not only about you, right? It's about the community and who we're serving. And so, all right, we know police is going to be there. There's a way I can still do my job and not have to interact with them. Q, you my boss, you handle that. I'm staying away from it. I'm going to do my work. I'm not going to disrespect them. But any issue I have as a frontline worker, I'm going to my manager, my supervisor, and letting them handle that.
Yeah. Most definitely. Most definitely. That's good stuff, man. That's good stuff. So we got about 5 minutes, 7 minutes left. I got one question left, but then I want from the audience. Then I want everybody to have their last closeout. Your closeout statement in the situation, if you want to get contact information or what have you, as well. So the question is from Luana. She's in Inkster, and this is her third year doing a gun violence awareness walk in Inkster. She want to know how can she get funds for continuing education. So any ideas on funding and continue where she can find funding. So I'll start with Jennifer, and you can answer that if you want to give your closing piece as well. And then we'll go to Juan, and then we'll close out with Quincy as well.
Thank you. I think, again, there's opportunities for local partnerships, looking at what is available locally for funding. I know that, I've had conversations with Inkster, and certainly there's a lot of interest in supporting some of this work. So that is one thing that I would say. Also, there's others, what I try to do, and shameless plug, give you my email address, delacruzj@michigan.gov. So one thing that I'm trying to do is also build awareness when there is funding that comes out, to be able to share that with folks in this space doing the work. And so I guess I'll just slide into my last piece of, here at the state, we are just excited to be able to play a role. We all have roles to play, our role in terms of really helping to invest and support this work, as well as bringing folks together. So, sharing resources, bringing some folks in that have that experience in locally or state or nationally, sharing funding opportunities. So that is sort of an area that I see that we can play, and very excited to be able to continue this dialogue with others. So thank you.
Thank you. Juan.
Yeah, no, I'm just, like you said, I'm appreciative to be in these spaces to continue to build with those that, care about this important issue. Here at Giffords Center for Violence Intervention, one of our things is to push the CVI field forward, but also do that in collaboration with other folks that care about this, and making sure, right, that we continue to bring diversity, equity, inclusion, the buzzword DEI, right? But truly honoring that and trying to make sure, in this space that there are Black and brown people that have done this work for a long time, making sure that those voices are elevated, making sure that they're elevating in the space that they're in, whether that's a pay raise or a higher position. But also we know the different facets of the work, right? We have the researchers, right? And we know most of that been, white folks, right? But we also, again, how do we make sure that, not to say that they don't have a space, because they do, and they're experts in their own rights and have done some great work. But how do we make sure, like, some of these guys that have been on, men and women that have been on the front line, want to be in that space? And if they're interested, how do we get them there? And things like that. So again, like I said, I'm going to always continue to advocate for my fellow frontline workers forever. But again, just honored and appreciative to be in the space. And as I always say, for the frontline workers, that when you see me, see you.
Right, all right. Thank you. Brother Quincy.
That was a good one. I love that, man. So yeah, same with me, man. I'm just I'm grateful. I think we have come a very long way, in where we've come, and the space that we're in CVI work, and making sure that we're professionalizing the work, right? These individuals with the lived experience, who know the streets, who were once responsible, for the violence, right? Making sure that they have a voice and have that platform, just really reverse this thing and have a space and know that their voice is respected, they're heard, they're given a platform, to elevate their voice. And that's what's important to me. And I feel like that's kind of what my mission has been, because without that, where do they turn? Where do they go? Oftentimes continuing the same lifestyle that they were in before. But know that that having them a part of this work, it's extremely valuable. So that's really, has been my mission, and kind of where I find myself, at recently, in that kind of space. We've got a team here in Detroit, man, of, folks who are dedicated, man. And again, we've come such a long way, and just honored just to have a small role in that. But I feel like, what we're seeing here in Detroit, the collaboration we've never seen this level of collaboration before. And I think that is what is really going to make the difference in us understanding that it takes all of us, right? We all have a role, we all have a space, and let's begin to elevate each other, right? And respecting each other's lane, not me versus you. That's why we're in this mess in the first place, right? But respecting everybody else's lane and what they bring to the table. Again, it's all of our problem, right? So all of us have to be a part of the solution.
Most definitely. No, thank you. Thank you. And most definitely, as Quincy was saying, we all in this, we all got a piece to play. If that's advocating, if you do legislative, if that's your lane, we need you in there. We need you continue to put pressure on local, state administrations to make sure the funding stays there for all of these great organizations that you've heard about and the work that they're doing. If it's federally, we got to Break the Cycle of Violence Act that we at Amnesty International is pushing, and other organizations across the country, Giffords and others, that will provide funding, sustained funding for like 8 years, for these organizations to really do some groundbreaking work and not have to worry about funding every fiscal year. But they got the dollars there to continue to work. And so if it's advocacy, if it is getting on the ground and working with young people or what have you, there's a lane for you. So we implore you to get involved in some form or fashion. All of our contact information is in the chat. So please feel free to reach out to any of us to continue the conversation as well. I want to thank Sister Jennifer, Brother Juan, and Quincy for this great conversation. And again, as we close out, it's not over because the work continues, and we will keep doing it as we always do. So thank you everyone for joining us this afternoon, and we will talk to you soon. Take care now.